Welcome and thank you for tuning into A Sound Constitution on CHLY 101.7 with Lindsay, Manisha, Nilafar, Sanas, Isaiah, and Kristen.
We are third-year nursing students at Vancouver Island University in Nanaimo. We are here working to demystify health issues in and around our community, bringing you evidence-based information about your healthcare options.
This information is for educational purposes only and does not replace the advice of your primary healthcare provider.
We'd like to start by acknowledging and thanking the Nanaimo First Nations, whose traditional territory we have the opportunity to learn, live, and share educational experiences on.
Hello and welcome to another episode of A Sound Constitution. My name is Sanaz and I'm your host for today's show. Today we are going to talk about immigrant health. First, I would like to give you the definition to some relevant terms that we will be using during our show. Many different terms are used to describe refugees and immigrants. Using terms properly is a significant way of treating people with respect and advancing an informed discussion on the issues. There are a few definitions that the United Nations High Commissioner of Refugees has explained. Refugee is a person who has fled their country and needs international protection because of a risk of violence or persecution were they to return home. These include people fleeing wars. Refugees cannot be returned to their home country unless it is on a strictly voluntary basis. Asylum seeker is a person who has applied on an individual basis for refugee status and is awaiting the results. Asylum seekers are given international protection while their claims are being assessed, and like refugees may not be returned home unless it is on a voluntary basis. Immigrant is a person who has settled permanently in another country. Immigrants choose to move, whereas refugees are forced to flee. Permanent resident is a person who has been granted permanent resident status in Canada. The person may have come to Canada as an immigrant or as a refugee. United Nations High Commissioner of Refugees, or UNHCR, reported that war, violence, and persecution have uprooted more men, women, and children around the world than at any other time in the 7-decade history of UNHCR. According to a report published June 19, 2017, the UN Refugee Agency's annual Global Trends study found that 65.6 million people were forcibly displaced worldwide at the end of 2016. It noted that the pace at which people are becoming displaced remains very high. On average, 20 people were driven from their home every minute last year, or one every 3 seconds, less than the time it takes to finish this sentence. So why Canada accept refugees? According to the Conference Board of Canada, Canada's refugee policy is driven by humanitarian values of compassion and fairness. As one of the world's most privileged nations, Canada sees it as moral obligation to offer protection to those in need, viewing refugee resettlement as an integral part of its responsibilities within the international community. Canada plays an active role within the international community as it helps address emerging challenges, and through various memberships, alliances, and agreements, it seeks to advance the country's social, political, and economic interests. Accepting refugees allow Canada to meet these objectives. Maclean's, a Canadian weekly news magazine, in September 24, 2018 wrote, "The refugees themselves do not want to be dependent on external aid. After putting a roof over their heads and getting food for their kids, they all want to work. They take pride in their ability to provide their families and contribute to their host communities. They are keenly aware that international aid is precarious, especially as new crises emerge and resources are limited. In the most improbable circumstances, women open small businesses from selling food to designing clothes. Seeing refugees as economic agents and contributing neighbors and not the passive recipients of aid will be crucial in changing the story of refugees being burdens to valuable members of communities until durable solution can be found." If you're just tuning in, you are listening to A Sound Constitution on CHLY 101.7 FM, and we are talking about immigrant health. This has been Sanaz, and now we are going to turn it over to Manisha and her topic on international students.
Thanks, Sanaz, for the valuable information. Hi, everyone. This is Manisha, and if you're just tuning in, you're listening to A Sound Constitution on CHLY 101.7 FM. I'm going to talk about a special immigrant group today, the international students. International students look to Canada for an opportunity to access one of the top-ranked countries for higher education in the world. International students are treated as economic commodities in Canada. Yes, that's right. Unfortunately, Canada's excellent reputation is being used to recruit more and more international students to fill the gaps in funding with inflated and predatory tuition fees. According to British Columbia Federation of Students, international students have been used as a means to boost the Canadian economy. In a global report, Affairs Canada, Rosalind Kunin and Associates outlined that the economic benefit of international students studying in Canada is substantial. Without any regulation of non-resident student fees, international students pay as much as 5 times the fees paid by Canadian citizens and permanent residents. In March 2015, the Minister of Advanced Education, Andrew Wilkinson, stated that the sale of education at a profit to international students by colleges and universities was designed to be a major component of the funding model for BC's public post-secondary system. International students not only pay significantly higher amounts as compared to their domestic peers. In fact, their fees generate a profit for each respective institution that is used to offset reduced public funding. Additionally, these students pay vast sums into the local economies across BC on such as housing, food, transportation, and entertainment. In 2015 alone, international students in BC added $3.117 billion in spending, created 26,000 jobs, and contributed to $1.77 billion to the provincial GDP. In BC, as in most of Canada, international tuition fees are unregulated and can increase at any time with no notice. Domestic student fee increases are capped by 2% annually under the BC government's tuition fee limit policy. Meanwhile, tuition fees for international students in BC have increased by 64% since 2006. International students are paying more than their fair share into BC's public post-secondary education system. Due to government underfunding, institutions have come to depend on the revenue they receive from increasing fees for international students. Tuition fee levels are based on whatever the institution are required to balance its budget. This is an unsustainable model that often results in students struggling to stay in BC to finish their studies. This dependence normalizes the model to private post-secondary education, but it also stands in contrast to progressive values and United Nations Universal Declaration of Human Rights. The lack of any regulation on international tuition fee increases means that these user fees may go up by any amount in any given year. It is unfair to students and is not reflective of Canadian values towards consumer protections and contrast to how Canadians would want their own young people treated abroad. A 2013 study by World Education Services concluded that 47% of international students do not have strong financial resources. International students in British Columbia are worried about their finances, but they lack the financial and institutional support to help them manage this burden. Poor understanding of international student funding and financial pressures leads Canadian policymakers to create a system in which international education is only open to wealthy ones and excludes those whose families are not wealthy, but who collectively work together to send their children abroad for post-secondary education. Policymakers must understand the current system of international education, which is unregulated and unpredictable. It is also irresponsible because it introduces great economic risk and instability to the province and the country. This also contributes to student stress and can result in some international students being forced to drop out. There is also a lack of social support for international students. A 2015 Canadian Bureau for International Education study highlights that international students do not feel socio-culturally or physically supported by their institutions. But even when some support is available, many international students are afraid to seek help for mental health issues, fearing deportation or denial of a work permit, which may affect their ability to stay in Canada. More than half, which is 56% of the international students in this study, have reported having 0 Canadian students as friends. At present, institutions clearly value international students financially, but aren't putting in the resources to support the value of this diversity on campus. Research has shown that when institutions take action to embrace diversity and create socially supportive school context, this can improve the social inclusion and academic success of not just international students, but also for all students. As a former international student, I'm well aware of these struggles. It also includes accessing the healthcare system and acquiring the work permit right away. Despite heavy tuition costs and low income earned by international students, they do not even qualify for medical services premium assistance. I know that they're not residents and probably not entitled to this service, but given their contribution to Canadian economy, we need to, or Canada need to make it fair for them. Just because someone chooses to leave their country, it doesn't lessen the challenges a person faces in a new environment, culture, and country. International students are usually by themselves in the country and have left their family and friends back home for higher education and better future. Therefore, support is needed for everyone, but it is mainly available for landed immigrants only by certain organizations in our local society. The international students either have to figure it out on their own or seek help from their educational institutions. Thankfully, Vancouver Island University International Building does provide some services related to renewing work permits, study permits, and some services about counseling and more. But these services are still limited. We need more programs and more organizations, even like Multicultural Society, which not only addresses the issues for landed immigrants, but also maybe incorporate some support for international students or temporary workers, so they can have some support available in the society. Going back to tuition fees, the regulation of student fees for international students would increase fairness, consistency, and predictability to their finances, and would respect those who are traveling great distances and paying substantial fees to participate in Canadian education system. It is time for fairness for international students. British Columbia Federation of Students is calling the BC government to amend the tuition fee limit policy to include the regulation of fees for international students. An annual cap moves international students one step closer to policy level and equal treatment with domestic students, and may help resolve some of the barriers to social integration with domestic students. Second, a new BC international education strategy needs to provide sufficient support for international students to assist in their cultural, social, and academic integration. To learn more about how you can help, contact your local student union like one in Vancouver Island University. For more information on international students in BC, go on www.vrbcstudents.ca and check out their campaigns, one of which includes Fairness for International Students. Thanks for listening to CHLY 101.7 FM.
Now let's hear from Nilufar, who's going to talk about various dimensions of identity for immigrants.
Hello, CHLY listeners. This is Nilufar, and I'm going to talk about various dimensions of identity for immigrants. You may ask, what is identity? According to the Canadian Identities, an interdisciplinary overview of Canadian research on identity by Rumans, there are two aspects of identity. First one is self-identity, which includes the process of cognition development and maturation, which is also partially socially influenced. This part of the self could be referred as to his or her personality, such as self-confident or self-image. The second type of identity, and related to the first, is that of socially constructed identity by others. And individuals begin to progress through their social space over time. They start connecting with the social world. The influence of these events over time impact both the personal self-identity as well as social identity each of us has at any point in time. So, when people enter a new country due to various reasons, they may become part of the minority groups in their new society. According to the Prejudice and Racism book by James Jones, any Any individual that operates in both the dominant and minority world is referred to as bicultural. This issue of duality gets harder when one tries to exhibit elements of both cultures and tries to maintain the central tenets of both cultural worlds. The end result is that for those who live in two worlds, the lives are restricted in one but not the other. They become marginalized. According to the Immigrants, Integration, and the Intersection of Identities article by James Friedores, immigrants arriving in Canada find themselves in a social environment that is confusing, frustrating, and challenging. In most cases, they will find that holding the status of immigrant does not enhance their identity, nor does it facilitate their ability to integrate into the host society. In short, once the immigrant is in Canada, there are a few benefits. The experience of living in a different country is different from people with various age groups. For instance, young immigrants aged 1 to 9 years old enter Canada with a minimum self-concept and identity. Their cognition development is flexible enough that making changes is easier and painless for them. These young people tend to be immersed by Canadian culture and language, so that their identity quickly becomes Canadian. While there are other markers that will impact this identity, these young people find it easy to fit into most of the social institutions of Canadian society. What may happen is that the child begins a collision course with her or his parents as the cultural gulf begins to widen. Youth immigrants are those who are 10 to 20 and have, at the time of immigration, developed a core self-identity as well as established their basic linguistic skills. They are then moved into a new cultural context before becoming integrated adults. For this group, they have tendency to become marginalized people in their new host society. They are bilingual, bicultural at best, but in most cases are neither. Those immigrants entering Canada as adults have settled their self-identity and other social attributes such as language skills and religious affliction. Usually they left their home countries to search for a better life with more opportunities for themselves and their families. In most cases, they are aware that they have to demonstrate endurance during this transition. This age group will never become engulfed with Canadian culture and are aware that they have to surrender themselves with minimum standards of Canadian culture, but will be grateful if their children can benefit from the society and available opportunities. Nevertheless, at the same time, they tend to retain as much of their country of origin culture as possible. For example, values, language skills, religious beliefs, and maintain their previous identities as the best strategy for coping with the new superculture.
Thank you, Nilufar, for the valuable information. Next, we are going to listen to a song called I See You in Me, which is a song for global peace and unity by Benga Adenuga.
Have you ever wondered that all humans are the same? Yeah. 'Cause you and I, we're one and same. One and same. Different colors, dialects differ, born of a woman, we're all the same. Male and female, poor and wealthy, young and aged, we're all the same. One breath, one light, our goal, a better world. One breath, one light, our goal, a better world. I see you and me and you, one and same. I see you and me and you and I, one and same. Different cultures, times and seasons, diverse mindsets, we're all the same. So I wonder why the battles stop the killings. We're all the same. One breath, one life, our goal, a better world. One breath, one life, our goal, a better world. I see you and me habitation, fleeing from a grasp. Climate change, seasons unsure, man's predictions now unsure. But we want voice and we want gold. Nature is restored, our world is renewed. I see you and me and you, one and same. I see you and me and you, one and same.
You just listened to a song from Benga Adenuga. In the next section, we are going to listen to our field team who has gone out this week to ask questions about immigration and health to the community. Let's see what they have to say.
Hey you!
Who, me?
Yeah, you! We want to hear what you have to say because
Your opinion matters!
Hello. Hi. Where are you from? Nigeria.
I'm from India.
I come from China.
I'm from India.
And how long have you been in Canada?
Less than 3 months.
Oh, for a while. I've been here since 2009.
I've been in Canada like 3 months. No, 3 years.
3 years?
3 years and 3 months.
I've been here since August 2018.
And how has your experience been accessing healthcare so far in Canada?
It's been okay, not too rigorous. I mean, there's a process. Yeah, so you just have to follow the process.
And do you have any insurance or you have to pay?
I use the Guide Me. Although with Guide Me, you have to, when you walk into the hospital, or you get prescription for drugs, you have to pay, and then you send them the bill, you make a claim on it, and then they reimburse you.
Okay.
Yeah.
Do they give back the whole amount?
I don't know, but I was told that.
Okay.
Yeah, I haven't I've been to the hospital, to the clinic, but I sent the doctor, I paid a certain fee to see the doctor, but I haven't replied to Guide Me about made a claim. Not yet. I want to pile everything together, then send it once to them.
Okay. Yeah.
In the beginning, I did have a hard time because I did not have any information available about it. And another factor, I think it was that it was not, my income wasn't much. You're not even allowed, at that time in 2009, you weren't allowed to work while going to school for first 6 months. So I couldn't work and my income was low, but I was still required to pay as into MSP, which Canadian citizen wouldn't be if their income was that low.
I remember it was to be 2 times. The first time I felt bad and I went to hospital, and it's taken me a lot of time because I have to wait. I do not have the family doctor here. And the second time is I need to have the vaccine. So I went to the healthcare Nanaimo, and it was quick.
I've never actually accessed any of the healthcare services because I really didn't need to. But how much ever information I've had from the university and from the website is that, I can get services from the physicians who are enrolled with MSP. I can have eye examinations and diagnostics like x-rays, maybe massage therapy, and even oral and dental services like root canals, fillings, and so on.
How is the healthcare in Canada different from your own country?
Okay, I would say in my country, apart from the insurance, because we don't really get to do insurance on our health, although out of 100% Nigerians, let me say 30% of us have insurance on health, but the remaining 70% is just walk in and see the doctor, and it's not so expensive.
Okay.
Like in Canada.
And do you have to make appointments to go to the doctor?
We don't have to make any appointments. You just walk in, you see the doctor. There's always there are always doctors around.
Yeah.
Well, I think Yeah, they do. Okay, so the doctors in Nigeria, they follow up. For example, you have to, when they see you the first time, you need to, they'll give you like a next appointment date.
Okay.
And then you can come again to see the doctor. I think they also do that here.
Okay.
Yeah. But, and then you can get family doctors as well in Nigeria, and they also do that here. So.
There is a lot of differences. There's good and bad points, I would say. In my country back home, healthcare is private, which you would have to pay. I think that is could be expensive if it was that way here. But because I was an international student, I was paying here more than I would pay in my country to see a doctor. And in my country, you can see a doctor right away. There is a doctor clinic at every corner pretty much in my city. Whereas here, you would have to wait. You would have to get an appointment. I also had a hard time getting my family doctor here in the beginning, but I eventually got it. So there's quite a bit of differences, I would say.
Compared to my own country, I think the Canada, they have more detail about the patients and also the doctor, but in my country it's gonna take short and cheaper than in Canada.
I see.
So in my home country, that's India, the insurance comes into the picture only when there's a surgery or an operation that's going to take place. But usually for consultations or just when you're, visiting for the doctor just to show your symptoms or ask him, what's going on, we just have to pay upfront. The insurance doesn't cover that, how much ever I know.
Okay. And how has being in Canada had affected your overall well-being, especially in the beginning?
If I recall back at that point when I came here, I had no knowledge about how everything worked. There is very less information that is provided when you apply to go to a foreign country. I didn't even know that my fees was almost 3 times, at that point was 3 times higher than domestic students. Now it's 5 times higher. I had no idea. I was just told that it's for better future and good education, so I took the opportunity. But as I come here, I wasn't allowed to work, and I almost was running out of money, and which was very stressful. Within 4 months, I ran out of almost all the money I brought from home, which was almost $3,000 or something, I think. I don't remember the actual number. And then you couldn't work for next 2 months, so you'd have to, again, put a stress on your family who had already, my dad had already spent all his retirement saving on me, so I felt bad about that, but I had to do it. I was in huge stress, and because I was here alone too, it added to it. I didn't had any family here. I had bare minimum friends, but eventually it got better because Canadians, I must say, are really nice and welcoming. But in the beginning, you do have a hard time because there's a cultural shock and your family is so far, you can't share anything with anyone here. So there is a lot of challenges. And then with the tuition fees being so high for international students, I just always felt it wasn't fair. I understand that it shouldn't be maybe the same because it's a way of boosting economy for Canada, but it shouldn't be that much of a difference. We need to ask ourselves, is it really fair to take from one part of the community to give to the other? Because international student fees fund our Canadian post system, right? Education system. So yeah, there's some inequities that needs to be addressed, I feel.
Thank you so much.
Yeah, no problem.
Not that much, because I went back to China like 2 times each year, so it's not like the mental effective, but more likely the physical body effective, because in Canada I become more like to get allergy because the flower or wind, I don't know.
Okay, thank you so much.
So when I got to Canada, frankly speaking, I came with a lot of mixed feelings that, how am I going to adjust and all. But the moment I came in, my tenants are really warm and welcoming from day one. There's always been a sense of belonging. It's like a small family to me. And yeah, with respect to the university, the professors, students, international, everyone's very, very warm in that way. All the professors, if I have a problem, I just go to them and just ask questions, and they are very open and kind to answer them all. So, and yeah, I keep visiting places, see new places. People are very friendly. I've never had like a dull moment where I'm like extremely homesick. It's been nice.
Okay,
Yeah.
that's great. Thank you so much.
No problem at all.
Hi there. So my question is, how do you find healthcare services different here than your country?
Well, it's very much organized, and I feel the doctors are good over here. Everything has a proper procedure to follow, unlike in my country where I can visit different doctors and get different medications. But over here, we can have faith in the doctors.
Thank you. Hi there, our participant is from Bangladesh, and my question to you is, what factors affect your well-being in new environment? How do you cope up with the change in culture, food, and ways of being?
Actually, in this type of country, we are not used to this culture and the environment actually. Because in my country, way back in my country, it is like conservative and this kind of mindset, and this type of countries is way more free-minded. So there is lots more scopes for breaking the shackles, like what kind of passion you have, you can dreamed of, so you can execute these things. And the people are always really sweet actually compared to subcontinent people. So yes, these are the really boosting things for this country, I guess.
Okay, thank you so much.
Today we are talking about immigrant health. Thank you, Nilufar and Manisha. Those were the thoughts of members in our community. Up next is an instrumental piece called Dialogue, composed by Sina Shoari. The basis of this composition is rooted in Persian classical music with a modern approach. This is a new collaboration between Haddadi and Shoari. I hope you would like it. That was a Persian instrumental piece called Dialogue by Pejman Haddadi and Sina Shoari.
Now let's hear from Isaiah, who will talk about mental health in immigrants and refugee populations. Thank you for listening to A Sound Constitution on CHLY 101.7 FM.
My name is Isaiah, and I'm going to dive a little further into Canadian immigrants and their respective mental health. Imagine yourself in your daily life for a moment. What do you have access to and why? Access to banking, access to insurance, access to healthcare and respective prescriptions. For the most part, it's pretty easy to manage these things. They've become almost trivial in our life. For the immigrants in Canada who wish to seek out these seemingly trivial items of life, it can be quite stressful due to language barriers, separation from family, potential racism, lack of social support, lack of transportation, immigration process itself, settlement, or temporary unemployment due to international contingencies. Consider this. The World Health Organization estimates that around 450 million people worldwide are suffering from some sort of mental illness, and that's only the documented cases. With this statistic in mind, it seems increasingly probable that people who have immigrated into Canada and now face many more stressors would be increasingly susceptible to anxiety, depression, or other forms of mental illness. In 2006, the Government of Canada said that the proportion of foreign-born population to Canadian resident is 1 in every 5, an amazing statistic for our beautiful country, Canada. The well-being of Canada's immigrants has just as much consequence as Canadian residents for our nation's future. In 2007, the World Health Organization defined mental health as not merely the absence of mental illness, but a state of well-being in which the individual realizes his or her own potential, can cope with the normal stressors of life, can work productively and fruitfully, and is able to make a contribution to their community. This definition raises an interesting question. While the World Health Organization says that although mental illnesses have similar symptoms across cultures, their manifestations and how people describe and interpret them vary with ethnicity and culture. This calls for an increase in cultural sensitivity from our healthcare system, don't you think? If varying interpretations of mental illness symptoms are misdiagnosed by a physician, the mental illness can be left untreated or made worse. So, what can you do, or what can we do? While using a translator may seem like an excellent option, not everyone has access to this. If you do, this is an excellent option, but as I was saying, this isn't always feasible, especially in moments of crisis. However, Vancouver Island Health Authority provides access to phone interpreters through Provincial Language Service. Additionally, this amazing resource can also provide an interpreter to accompany you or a patient to medical visits. If you require this service either through the phone or in person, you can give them a call at 1-888-603-5087. If you didn't catch this resource will be made available on A Sound Constitution Facebook page. On another note, for Syrian refugees, there is a refugee health line that will assist with initial medical assessment and further referral if needed. You can call 1-866-286-4770. Again, if you didn't catch that, this resource will be made available on A Sound Constitution Facebook page. While some of this can seem a little daunting, data from the World Health Statistics database of the World Health Organization compared suicide rates between the Canadian-born and immigrant populations. These suicide patterns were examined by age, sex, continent of birth, and residence. It was found that immigrants are much less likely than native-born Canadians to commit suicide. When the rates of suicide were compared only measuring the variable of age, the suicide rate of immigrants is almost half that of Canadians, measuring 7.9 per 100,000 people compared to 13.3 per 100,000 people. This information does not disclose the actuality of depression, anxiety, or other mental illness without suicidal ideation, otherwise known as thoughts of suicide or self-harm. If you or someone you know, regardless of ethnicity or race, is having difficulties with their mental health, please suggest professional help. Mental illness is not to be taken lightly, and while it can be managed on your own, it may require professional medical attention. Thank you so much for listening to this segment.
In this segment, we are going to listen to an interview with Walid Talhu, who is an immigrant settlement worker and resettlement coordinator at Central Vancouver Island Multicultural Society.
So I would like first to share some information about the Multicultural Society, about the history of the Multicultural Society in Nanaimo. It's a community-based organization. It's a non-profit organization. It was founded in 1979 by the community, and our main job is to provide service to immigrants and newcomers. Some of our role is to offer English classes to newcomers. We offer settlement process and employment, and there is some other service relating to those jobs or the service that we do. We are a community-based agency that works with the individuals and organizations to ensure that all those in our diverse community have equitable access to its services and opportunities. We are client-driven and committed to being accessible and responsive to, as well as reflective of our diverse community. Our mission is we are committed to promoting the values of equity, diversity, inclusion, and respect for all people. So that's some of that I would like to share.
Yeah. The next question is the process that the immigrants go through when they first come to Nanaimo to make the transition to a new life.
Awesome. So newcomers pass through several stages in their life. Okay. So the first day coming to a new country, they will face some difficulties. Those difficulties depends on how much that this newcomer is prepared. So, and depends on the culture, depends on the language barrier, depends on the communication barrier, and also depends on the culture difference. So I will talk briefly about those stages, and just to let you know that many people go through several steps or stages in their adaptation process to Canada. Some others take longer, to adapt. So it's a normal process, but depends on the preparedness of this newcomer. So the stage one, which I call is compliance, or we usually call it as a honeymoon and euphoria period. There is high hopes and expectation that my dream became true. I am in Canada now. It's a dream that came true. Newcomers will feel very excited, and they are interested, and they are everything is new here, and they're interested in. They have their self-confidence, and they don't feel stressed, and they are focusing on the similarities between Canada and their own country. So that is stage one. We're going to stage two. Stage two is the conflict and frustration. So difficulties with, there's after a time, like the stage one usually take a month. Okay, so and newcomer will start facing those difficulties. So the difficulties with everyday challenges regarding renting, regarding opening bank account, learning English, school and daycare, going to a doctor, and going through a paperwork like childcare subsidy, like GST forms, like taxes forms, and that is will create stress to the newcomers. So in the first 6 months, actually, or during the first 6 months, newcomers will have good and bad experience, and they will sometimes be happy about the new challenges. But again, they will be sometimes very frustrated, confused, disappointed, and depressed. Also, very positive in a day and very negative the next one. They will start focusing on the difference between Canadian culture and their own culture, and they will miss their family. They will feel some guilt that they left their country and they left their beloved ones in that country. So this period too, sometimes they will feel they are sick without having any medical problem, and probably there's some problems with the partners will arise, and so it's really a hard stage for the newcomers. So now going to stage 3, it's called a gradual adjustment and recovery. So gradually they will start adjusting. They will be able to communicate. They know the English now, or they are better in progressing in the English language. They will start understanding how services and programs work here in Canada, and they will start gaining control, understanding people and culture. They will have their good language, and the sense of humor will return back to them. So we can go to stage 4 now. The stage 4 is kind of acceptance and adjustment. So we are here in Canada. They will get more involved. They will understand better the system, and they will no longer regret coming to Canada. So again, many people can experience these stages at different time of their lives, regardless of the number of years living in a new country. It's not depending on the time that you are in Canada. But again, I can just give some more explanation about the stage of adaptation. It's not always linear. Like what I mean by linear is it's not always start and finish in a stage, or you can move from stage to stage, or you can move from one stage to the next one. We call it spiral, because you might progress in some area while still experiencing challenges in others. But the good thing is that you will gain experience in every new chapter.
How do these programs help with mental and physical health of the immigrants? For example, do you guys put something for them to come together, to get to know other people, so that they won't be alone and this kind of thing?
Yeah, I will just explain more about our services. We help and support clients with their settlement process, with their employment process, and with learning English, as well as we do have also a child minding in case of the students, they have their kids, there's no daycare, we can take them here in our daycare. So that is something that helps them to learn English, to facilitate the English learning. For us here in general, we help newcomers to settle in the community and school by assisting and providing direct frontline services, including information, advocacy, and orientation and referral. So if a client came with, and also we do have info sessions, we do some presentations, we invite some people from the community to come here to give presentations, and we have some groups, which is those will help people or newcomers to socialize here in the community and to start knowing people and building relationship. So the first thing is actually we encourage the newcomers to know more people, to connect, to communicate, and that will prevent isolation. Our client needs assessment, as you nurses guys, you have nursing assessment. We do have client needs assessment to prioritize the cases, or the needs for a client, which is those needs that we work specifically on the needs to get better outcome for the client and to help them integrate easily here in the community. So we face clients, or we have some clients facing mental health issues. Some of our clients actually have PTSD, and it's affecting their settlement process here in Canada. So what we do for them is we connect with the health unit, and we have that connection. I know we connect with the nurses in the health unit, and they are so helpful. Yeah. So and how they help, we work together to make sure that they've been referred to the health community. Also, in case of vaccination, any newcomer will come here, we're advised to go for vaccination. And also it depends on the way that they came here. So if they came as refugees, it's different. They will have more needs than if they come as a federal skilled worker or as a business. So it depends on their category of immigration or class of immigration. So, but we support all our clients depending on their needs. We have actually partnered with a counselor that we used to refer our clients to a counselor in case of they need. IRCC fund this program, and the other thing is we do have interpreters too. It's not our own interpreter, but we contract some interpreters from the community to help and support with the language barriers. But it's still it is still, what we're doing, it's not sufficient to support the clients, because they are in need of extensive counseling. Some of our clients, they are in need of extensive counseling, that we're trying to be a partner with a agency called Vancouver Island Counseling Center for Immigrants and Newcomers. It's in Victoria, and those who are working with them now to get a proper way for counseling and to take care of mental health.
And how do you collaborate with other institutions?
So what we're doing is partnering with several services or several agencies outside, including like the Ministry of Social Development. So sometimes clients that they are in need of support or services, we can help the clients to apply for income assistance, to apply for some kind of support by the government. We help them also to get a subsidy for the daycare. So we help them through their process with the child care subsidy application with the Ministry of Children and Family Development. And you can name it, whatever, any service that could newcomers benefit with, we just refer them and we can communicate on their behalf. We advocate, we're not, we talk or we speak on their behalf after we get their consent, and it's more about supporting them and helping them. The important here is to prevent isolation. The number one thing is preventing isolation. Isolation could tend to mental health.
Yeah, another question is how do immigrants access the healthcare services when they first arrive in Canada?
That is a good question, actually. So from the day one that they arrive to Canada, again, it depends on the program and their immigration class. So if they are a skilled worker, we're not like differentiating between them, but again, even the government, they put some programs, depends on the client's need, on the client needs. And number one, if a refugee client come to this area, to Nanaimo, they will not be able to communicate with, to go search for a family doctor. So we partner with the Division of Family Practice here in Nanaimo, and the executive director, I think she was so helpful. Whenever any new refugee family arrive here, we just send this information to her, to this lady, and she was able to get us a family doctor for specific, or to assign a family doctor. So that's how it works here for refugees. For other classes of immigration, they can do it by themselves. They can search like either by friends. We used to have a list of family doctors here, but because it's changing, so we rely more on the Ministry of Health website to search for doctors. Sometimes people, they have connections. Okay, they come and get their friend to find their family doctor, and they will get them in their practice.
So, and the last question, what is your recommendation for the community members when it comes to immigrants and how they can cope with their challenges in Nanaimo?
Yeah. Regarding the community here, we are always doing some outreach to let the community know more about our services, know more about the immigration process and how much it's hard for a newcomer to come to Canada and to settle down in Canada. So they were so helpful, and they are still helpful. We have some newcomers emergency fund, which is, it's a donation from the community, that they support newcomers if they face any struggle or if they face some kind of medical problem that they cannot afford. So yeah, that's regarding the community. There's many things and many programs that it's targeted the community. Regarding the newcomers, my recommendation, like for newcomers, is to put an action plan, and be always positive, and try to learn English, because English is the key of this country. So if you know English, you can open any door. Again, you need to build some skills too. You need to build your communication. You need to find a job. Because first English, second job, third you will settle down in Canada.
Okay. how do you think that they can maintain or even improve their health and mental condition given their challenging circumstances?
And meet a counselor, because they can help with adaptation. They can give you some sort of idea or thoughts or information to adapt more within you challenges. So I think regarding the mental health, the counselors, they're a good start and good point to help and support. I am a newcomer, recently arrived to Canada, and I faced a lot of challenges, okay, because of my, to go back to my previous work, which I am a nurse. I was a nurse, I was a registered nurse, and I worked overseas in a big hospitals, and I used to be a manager for the emergency department. But coming to Canada and without this Canadian experience, without having your credentials evaluated, and to get the standards of what nurses do in Canada. So that is something that I know that the government, they're trying to support with that, and but it's still, there's many gaps. But of course, like, be positive and imagine where you will be after 3 or 5 years and work on this, have a strategy. It's a good strategy, or get yourself a good strategy to work on and follow. Yeah, that's it.
Thank you so much.
Yeah, no problem.
As we come to the end of the episode, we encourage you to reach out to your healthcare practitioner and other health professionals for more information. We hope you enjoyed today's episode, and as always, check out our Facebook page for resources from today's show.
If there is anything you would like to hear us talk about, let us know by email at asoundconstitution@gmail.com. Thank you for listening to A Sound Constitution on CHLY 101.7 FM.